everyone. Thank you for joining us today on Innovation Day. My name is Allison Hunter, and I am a Technical Service Manager at our flagship Solution Center in Houston, Texas. I'm here to present to you a session that will offer you some great insights and solutions to some of the most common challenges that developers of topical applied pharmaceuticals encounter. If you are in this space, you must be aware of the vast growth in medicinal creams and ointments hitting the market in recent time. Well, we've done some research and development of our own and are here to share the findings that may just help you in your current or future product formulation journeys. If we already serve your business, you must know that ingredient and supply chain services aren't the only solutions we provide. At Univar Solutions, we also support many of our customers across many disciplines, innovating and growing their business. With our team of technical experts and network of labs, we are on the forefront of market trends and new formulation developments to share with you. And I'm happy to be here today to introduce our Making the Grade Plus prototype formulations and share some insights and innovations we uncovered for topical treatment applications. We understand that developing a topical medicinal product is no easy task. Finding the right ingredients that together produce the right efficacy, sensory characteristics, and product stability can take a lot of time and resources. Other common challenges when formulating a topical product are making sure the topical doesn't metabolize when applied to the skin, that it also dissolves at a right concentration, and achieves the appropriate release rate. On top of formulation challenges are the headwinds when commercializing a product to market that may offer a vast selection of alternatives to meet the same need. How do you set your product apart? Furthermore, in today's environment, many pharma companies are challenged with key ingredient supply disruptions and increasing manufacturing costs. And let's not disregard the ongoing regulatory shifts that may require an adaptation to your original formulation. And in the pharma industry, there is no room to sacrifice ingredient quality and purity to save costs. On one end, product formulation challenges can prohibit your product development journey and innovation. On the other end, market and commercial challenges can cost your business profitability, production continuity, and growth. So what can you do to tackle these challenges? And what can we do to help you? At Univar, we like to say that we are essentially serve as an extension of your organization's team. And that was our mindset as we approached this pharmaceutical topical formulation project. We put ourselves in your shoes and underwent a rigorous process of research, testing, and development to identify specialty excipient ingredients that excelled in delivering a formulation benefit, be it improved stability, enhanced sensory attributes, or greater patient appeal. The benefit of being in the distribution space is that we have the knowledge of and access to a universe of brands and ingredients to play with within our own labs. Furthermore, our team has access to market insight resources that provide us information on growth drivers, trends, and innovations in the pharma industry. From our market assessment, we learned that the topical treatment space is vastly growing. In fact, the topical treatment market is projected to generate $129 billion globally by 2025. There are numerous reasons for this growth. The prevalence of skin and soft tissue infections such as psoriasis, eczema, skin cancer, and vitiligo is on the rise. According to the World Health Organization, between 2 and 3 million cases of skin cancer are diagnosed annually across the globe. Number 2, consumers prefer painless and easy to administer treatments. If you compare applying a drug through the transdermal route versus the oral or intravenous routes, applying a topical cream or gel is easier and usually without pain. Easy drug application is important for all, but it's even more important among the elderly population. Considering the aging population is expected to triple within the next 3 decades, we should expect an increased demand for easy-to-administer drug treatments, including topicals. As a result, we should see a broader range of topical products come to market. Number 3, another market driver for topical treatments is a preference for treatments that avoid first-pass metabolism. Often, a patient has greater concerns of addiction or gastrointestinal tract irritation when ingesting an analgesic versus applying it to the treatment area. In general, topical treatments are known to have lesser side effects and risk of addiction compared to other drug administration forms. And topicals are perceived to offer calming and therapeutic benefits, such as helping to relax muscles, lower heart rate, and increase the production of endorphins. You may even find products on the market that incorporate fragrant aromatherapy scents or CBD to help soothe and calm the body and mind. As we continued our research analysis, we sought out topical treatment cream and gel products currently on the market to use as benchmarks as we developed our own formulations. We identified the excipients, ingredients, and actives used in the commercial products and compared these ingredients against our specialty ingredients from our portfolio. Our goal was to find the ingredients that helped in achieving or exceeding the positive characteristics of the benchmarks, including properties such as rheology, aesthetics, and stability. As we underwent the formulation process, we made sure to clearly define the treatment goal, the nature of the active ingredient, the consistency and texture we desired, and the sensory effect we wanted to deliver. All of these factors are as important as efficacy. From our research, we learned that oftentimes consumers will turn away a cream or gel because of its stickiness, oiliness, smell, or other unappealing characteristic of the topical. From our testing and formulation process, we developed 3 medicinal topical prototypes shown here. Through these prototypes, we were able to demonstrate the benefit of certain specialty ingredients selected from our portfolio in actual topical applications. The first prototype is a topical pain relief cream. The second is a topical pain relief gel. And the third is a topical SPF 30 scar treatment gel. Each of these prototype formulations consists of excipients and ingredients that are fundamental in all topical products, including a topical emulsifier, which allows the formation of an emulsion consisting of immiscible liquid components, a topical diluent, which dilutes the concentration of the formula. In water-based formulas, water functions as the diluent. Topical chelating agent that binds with trace metals to prevent an adverse effect on color, clarity, or shelf life of a topical formulation. Topical humectant, which works to hydrate the skin by attracting moisture. A topical emollient, which works to smooth and soften skin and may help to trap moisture depending on the level of occlusivity of the specific emollient. A topical emollient may also function as a solubilizer for active ingredients that are lipid soluble. A topical preservative inhibits the growth of microorganisms, including bacteria, mold, and yeast. A topical pH adjuster adjusts formula pH. Alkaline pH adjusters can react to neutralize alkali swellable rheology modifiers to provide thickening in water-based formulations. Topical sensory enhancers impact the aesthetics of a topical formulation to eliminate or reduce negative formula attributes, such as oily or greasy feel, tackiness, amount of product shine, or other. A topical rheology modifier alters the way a topical formulation flows. Typically, rheology modifiers are used to thicken liquids, improve formula stability, modify application characteristics, and suspend particles within a formula. And a topical thickener, which increases the apparent viscosity of a topical formula. The first formulation prototype I'd like to introduce is the Smooth Relief Topical Pain Relief Cream. In this formulation, we combined a medical-grade silicone with a silicone elastomer, adding a workhorse chelating agent and a unique rheology modifier. The result was a semi-occlusive, easy-to-apply topical cream with a smooth, non-sticky feel for the utmost consumer appeal. The specialty hero ingredients in this formula were the DuPont Livia Q7 9120 20 centistokes, the DuPont Livio ST Elastomer 10, and Coral Pharmachem Acropol 974. This slide shows the typical properties and benefits for the 3 specialty ingredients in the pain relief cream. Each of these ingredients served a specific purpose in our formulation. The DuPont Livio Q7 9120 20 centistoke, because we used menthol as the active in this formulation. This silicone fluid was specifically included as a solubilizer for the menthol, which is lipid soluble. This viscosity grade was chosen as being fairly light and providing a non-heavy feel and rubbed into the skin quickly. DuPont Livio ST Elastomer 10. This silicone elastomer enhanced the aesthetics of the formula to provide a silky, non-tacky feel. Without this material, the topical cream felt sticky. Coral Pharmachem Acropol 974. This alkalized flowable rheology modifier was chosen since it's compatible with water-based systems. It worked to thicken the formulation and enhance its stability. Because we know that some people prefer the feel and nourishing comfort of applying a clear gel versus a solid cream, we also developed a topical pain relief gel prototype. In formulating this gel, we combined a proven polymer excipient to retain moisture, a high viscosity rheology modifier to thicken, and fumed silica to enhance the aesthetic. We complemented the formulation with vitamin E for oxidation protection, while providing a soothing skin sensation. The result was a medicinal hydrating gel that was residue and oil-free. The specialty ingredients we used in this formulation were Dow Carbowax Century PEG 300NF, Coral Pharmachem Acropol 980, Cabot Capisol M5P. So to review the specific purpose of these ingredients in our formula, the Dow Carbowax Century PEG 300NF delivered humectancy in our formulation. The Coral Pharmachem Acropol 980 is a grade we selected because of its compatibility with alcohol-based systems. It thickened this formula and also enhanced its stability. Cabot Capisol M5P. This fumed silica was added to provide a dry touch and non-tacky aesthetic to the gel. And the last prototype we developed was the Easy Care Topical SPF 30 Scar Treatment Gel formulation. In this protective scar gel formulation, we used a silicone elastomer to achieve a non-occlusive, silky smooth sensory profile. We enhanced the gel with UV sunscreen filters of SPF 30, which can help to heighten the treatment benefits of your formulation for greater customer preference. Note that for this formulation, we did evaluate in vitro SPF with our SPF analyzer. The specialty ingredients we used in this formula were DuPont Livio TI 3021, Young Bunzlauer Citrafol B1, and Calumet CW 8030K. Each of these specialty excipients had a specific function in the formulation. DuPont Livio TI 3021. This silicone elastomer provides a non-greasy, non-shiny aesthetic to the gel. Young Bunzlauer Citrafol B1. This emollient helped to stabilize the lipophilic active ingredient while also providing compatibility with the UV filters. Calumet CW 8030K. This microcrystalline wax compatibilized the silicone and the UV filters to provide formulation stability. All of the specialty excipients and ingredients we just went through, as well as the other products in these formulations, are offered in our portfolio. I encourage you to visit www.univarsolutions.com medical grade topicals for a deeper dive into these formulations and the medical topical application market. There, you can download copies of the formulations I just covered, request an ingredient sample, and read several articles published by our team offering further insights. We are also happy to provide you any technical information or regulatory data you may need. I'd like to emphasize that our technical team is here to support your business, whether you are at the start, middle, or commercializing stages of introducing a new product. We offer pre-formulation, formulation, and specific development for a variety of dosage forms, including topicals, semi-solids, tablets, capsules, and liquids. Our labs are equipped with speed mixers, homogenizers, tablet presses, and other equipment to support our customers through their product development processes. We can also support analytical testing for potency, dissolution, hardness, particle size, and more. And wherever you are located, we are there to support with technical solutions centers located across the globe. We have several labs throughout North America, Central and South America, Europe, and Asia, all equipped to support you in your research and development journey. Beyond the specialty ingredients we highlighted today, we take pride in our comprehensive portfolio of ingredients, excipients, and APIs for the topical treatment application. We also have a very broad portfolio of ingredients for all of the other finished dosage forms. With our robust distribution capabilities, our direct access to leading pharmaceutical ingredients and brands, and our pharma industry expertise, we are here to support you in finding solutions to your challenges. Please let us know how we can help. I would like to thank you for attending this webinar. As I stated before, we see ourselves as an extension of your team. If we aren't already working together, we hope you welcome us aboard. We are ready to get started on your next innovation.